order again. My name's John Boyce, and I'm one of those sort of creatures that you thought you'd got rid of, one of the politicians. But we keep creeping out of the woodwork. I'm a former politician, which is even worse. So I've returned to sort of normal life. But I haven't ever given up my passion for health. And that's why I'm here. And one of the reasons I'm here is because after my stint in the British Parliament and then during my stint in the European Parliament, we put together a written declaration on hepatitis C. And I am the proud author of that. I have no doubt at all, with a lot of help from my friends in the hepatitis family. And that made its mark, I think, in the Parliament back in November 2006. And looking at it now, it's very slim. The powerhouse would scorn this sort of piece of work. It's small but perfectly formed, I think. Because as I read this great report we've had, it is a great report, I was able to tick off the messages we were giving here in our original, and it's not all there, but a lot of it is. And we were calling for priority action for screening, for early diagnosis, for access to treatment and care. We were talking about the link to needle stick injuries. We were especially concerned then about the health and safety of health service workers. And I recall talking to people in the ambulance service who told me that when they went to an accident, it wasn't AIDS they were worried about, it was Hep C. And that made me sit up and take notice of this whole hepatitis agenda. And also in my time, I recall chairing in Prague, actually, a conference of people living with HIV and Hep C and TB in various combinations, sometimes all three. But the good news, of course, was that they were still living with them. And although many people were dying from those sort of combinations, it just showed that there was a hope and a determination among the patient family of those three disease areas which we needed to respond to. You've talked already about some of the challenges, the costs of not doing anything. You've talked about the need for awareness, and I can tell you everyone in this room is aware of hepatitis, but I thought I would check outside how many people understood hepatitis, and I got some surprising results. One person thought it was a skin disease, another one thought it was a complication that came from flu, and somebody else said, oh yes, it's liver and kidneys, isn't it? And there is an unawareness there which needs to be tackled, and that goes not just for Mr. and Mrs. Public, but it goes for Mr. and Mrs. Politician too. So the challenge is to make sure that people like me and my colleagues here, who are all well aware of that, but some of their colleagues will not be, that we all understand it. And particular, and Jessie here knows the finance scene, and I've always said that we shouldn't just talk to health ministers, we should talk to finance ministers. If they don't understand it, they will never release the resources to enable us to put our programs into practice. Well, as I've listened to the discussion so far today, I've heard a lot of good practice. We've heard a little bit of competition between La Belle France and La Belle Écosse. And for those of you who don't know it, one of the oldest alliances in Europe is between France and Scotland. It was an English alliance between England and Portugal, but that hasn't quite developed in the same way on hepatitis. But on the other hand, I did notice that John there trained, I think, in my constituency, St George's. So this was a case of England going to civilise the Scots. I can say that because 2 generations ago my family was Scots who came down to civilise England, and we didn't make a great fist of it, but that was good news. So now, again, listening to the good news, and good news from Bulgaria, good news from Slovenia, good news I think I heard from Croatia, that's all good. But we want to know now how the agenda is going to be developed, how it's going to be made to work. And there was that little spat. My former colleague Holger Kramer was saying he didn't like the word action plans. He preferred strategy. I don't think you agreed with it. I'm not sure I totally agree with him. I want both. Because to me, strategies are words. Unless you have the action, they don't mean an awful lot. So we want a strategy leading to an action plan, if I can put it that way. And we want to look at some of the issues that have been cropping up as we've talked. We've heard about prison health. And I'm very well aware that there are parts of Europe where prison health is still appalling. It's uncivilized, it's inhumane, and we need to do a lot more on that. We need to make sure that things like needle exchanges are well understood and possible. And I know in some countries that comes up against religious beliefs and ethical beliefs, and that has to be overcome. Then there's all the question of testing and the stigma that can come from testing if we don't get it right. Because I remember the testing we used to talk about when I was a health minister in Britain, and then it was to do with HIV and AIDS. And immediately people said, yes, but if I admit to having had a test, then I have to declare that to my insurers. And they will start to assume my lifestyle is of a certain type, and therefore I am being discriminated against. And that's unfair, and so we had to negotiate with the insurers that they wouldn't ask that question, because we wanted people to be tested. And that may well be something we need to look at here. We need to look at the issue of migrants and sex workers, and the specialist nurses, and the issues of data collection and registries, and the issues of comorbidity that I've referred to. And it's comorbidity very often between hepatitis, whatever the plural is, and hepatitis with other disease areas, but not forgetting hepatitis and mental health. Because when we were talking recently in Copenhagen on diabetes, we were looking then at the things like the diabetes and depression dialogue that has been established. And it may well be that we need to look in those terms as well. So, what can patients do? What can countries do? What can the WHO do? And maybe we might have a few thoughts on what the Commission can do, whether or not they are sitting in those chairs that I see in front of me. That's not the point. There are things that we will want to ask the Commission to do in our action plan and our strategy. And to discuss that, we have exactly the right people. You've already heard from our Bulgarian minister, and I can't get her name right, so Desi is what she told me last time. That was near enough. And Lucas I can cope with from the Cyprus, not High Commission, the Cyprus Permanent Representation, who is the health attaché for the current presidency. And that's an important role. And then we have Handa, who is from the WHO in Geneva. And we have Charles, of course, who represents Charles. Charles is upwardly mobile. He started as a patient, and he solved that one, not only for his own good health, but in terms of bringing people together to form alliances, and that's why we're here in many ways. He then went on to help create the European Liver Patients Association, and then not satisfied with that, he's conquering the world, and so he represents the world here today, and so links back to HANDA and WHO, which is why we put them next to each other. But I'm going to ask each of them to this is not a football competition, but Britain and Turkey and Cyprus and Bulgaria are going to give their thoughts, but also from the point of view of their particular institutions, and it's the thoughts on what we need to do next and how we can do it together, and who we need to help. What's the best way forward? Each will say a few words, and then I want you to come in and bring your expertise. You've come here today with thoughts, with ideas. You've developed some more as you've been sitting listening, and so I want to hear from you, and if I don't, I'll start asking questions of people in the audience. Usually frightens them, to just to see what people might like to talk about. Desi, would you like to just start off?
So what can we do together? I won't exhaust this with my voice, as I already spoke quite a lot today. I'd like to just highlight two things from the presentation before in general. First, I'd like to encourage other countries to get on the wave. It's difficult at first to make the commitment, mostly because of the financial resources that are required to make that commitment. But I believe that once well-thought, evidence-based interventions are made out, the financing would follow. And the reason why it's important for countries to get on the wave and move together is that we can learn from each other. If we only have 2-3 countries, then you know, it looks strange. Why are we only 3 countries? Maybe it's not cost-effective enough. Maybe the data that these 3 countries is using is not the right data. So, I mean, from a political perspective, getting more countries to work in that direction illustrates also that the interventions are universal. And then the second one is about collaboration within institutions. So we have the plans of the other countries that have already been developed. We're going to step on them and reach out to our colleagues to help us out in developing it. But working with institutions like the World Health Organization will be essential for us. And the way the collaboration actually is structured is that countries request technical assistance from the World Health Organization. So at this meeting we have already discussed to move forward and have the technical experts from the World Health Organization to get involved. And in that context, Bulgaria also is the chair of the Standing Committee of the World Health Organization. Standing Committee is the governing body of each region's World Health Organization. So we're the chair of the European region's Standing Committee. And we have an opportunity to set the agenda of all the ministers of health when they come at the regional committee. This is the annual ministers meeting organized by the WHO. So we have the possibility through that channel to work in making the Health 2020 strategy a live one by having strategies and action plans focused on communicable and non-communicable diseases in the long term. And to come back to other countries, to the first comment that I was making is that I think the biggest challenge and what we need to make sure happens is that it becomes a living plan, not one of those that is on the shelves and 3 years later another deputy minister comes and read through to see there is copy and paste from another document, but something that we're looking into as a guiding principle of the interventions that we're making. And for that, we need collaboration among countries and among institutions.
So, do you think the as the European Union, the Commission develops, for example, its policy of cross-border health, it should be doing more. I mean, within that, there are opportunities for reference centres, specialist teams, and so on. Is there more that Europe as a whole could do?
Absolutely. Absolutely. I mean, the EU investment is the way it's distributed depends on national policies. So whether we invest in health, it's a country-based policy. And I think that though there is a discussion now on the EU investment to increase conditionalities, to introduce conditionalities. So the funding is conditional on reaching certain targets in terms of disease prevention, for example. So that's just at the level of discussion, but it's not a reality yet.
Because I think one needs to remember all the time that although for health services, that is entirely or largely a member state competence. For health promotion and prevention, that is a European Union competence and has been ever since the Treaty of Amsterdam. And indeed going way back to the early days, things like health and safety at work, when we're looking at needle stick injuries and so forth. There are European competencies there, which perhaps we need to develop a little more. Let me turn then to the current president, if I may call you such. The presidency of the Union is, of course, in the hands of Cyprus, and perhaps Lucas can tell us a little about where this fits into Cyprus's plans for the presidency.
Thank you very much. Indeed, this is one of our priorities as a presidency. Communicable diseases is high in the agenda of the presidency, and this is one of the reasons that this event is under the auspices of the Cyprus presidency. I'd like to echo a bit what my former colleagues said before in regards of early prevention, early diagnosis, early detection. In times of austerity, we need to improve the health systems and to ensure the sustainability of the health systems. One of the ways is to change how we tackle diseases. The trio of the presidency, Poland, Denmark and Cyprus, had focus on early detection, early diagnosis and early prevention as a new strategy to tackle various diseases. One of them is, of course, the hepatitis in all forms. And it is true that in Health for Growth, hepatitis was not mentioned, HIV was, but the member states and the European Parliament insisted on including this. So in the new Health for Growth program, which is from 2014 to 2020, we are looking at hepatitis and ways on tackling the spread of hepatitis. Of course, as much as I want to say that we're going to solve the problem, this is not the case, because if you compare the budget of Health for Growth, which is 446 million in a period of 7 years for 27 member states, plus the countries, the candidate countries, it's not much. If you compare it with other programs like Horizon 2020, which is billions, the people are tending to look at health as not as an investment, but as a big black hole where they're throwing money in it. We need to change the mentality. We need to emphasize the fact that if we do things right now, then the next generations will be more healthier, active. Of course, they will be able to produce more work in the future and for the future generations. and meet the goals that they want them to retire in the age of 67 now, which is a remarkable thing for me to imagine that people will work until that age. And so we need to have...
Welcome to Sweden.
So we need to have the population healthy in order for them to grow and to be able to work until the late ages of 67 or whatever they will decide. Thank you very much.
Thank you. Do you think you need more pressure on you as the presidency to so that you then gather your colleagues to put more pressure on the Commission to do more, to spend more, to plan more for the hepatitis issues? And if you do, would it be helpful if everybody here went home and got out a pen and paper or an email and wrote to their personal representative in the European Parliament, for example, and said, we got this disease area into the policy on paper, what are you going to do about it in practice? Would that be helpful? It's just a thought for, never assume just because we've achieved one step, getting a policy on paper, that that's enough. Because somebody else will be pressing for an alternative priority. And you have to keep asking, well, what are you doing about it? And I think that might be something that the liver community, if I call you that, might be aware of. And are you working with your colleagues from Ireland to hand over this policy and to make sure that they do something during their presidency? And then Lithuania after that?
Yes,
and then Greece. Sorry, yes.
the next trio.
Right.
Do you want to say how you...
In the Council we have the inherited agenda files, which are the files that the presidency inherits from the previous one. So in our term now, we are giving the files on health for growth and on cross-border health threats to the Irish presidency. We have progressed a lot on these files, and we have made a lot of improvement on the proposals given from the Commission. And as you know, the Commission is the one that brings on the proposals, but the Member States and the Parliament are formulating them in a way that suits the needs of the EU citizens and in each Member State. So.
Very good. Just another thought. The Irish Commissioner, Moira Geoghegan-Quinn, is of course the Commissioner for Research. She has a very big budget. The health budget is tiny in European Union terms. The research budget is quite large, and within that there is quite a substantial health research budget. So that's another perhaps point of pressure for developing the collaboration as we come towards the Irish handover. Good, thank you very much. Now let me come to my good friends from the WHO. I'm a firm believer in the collaboration between EU and WHO. It hasn't always been as positive and as healthy as I would have liked, and I think we're getting there, aren't we? And
you and I, yes.
Well, we'll talk later about that. But yes, I think in terms of achieving some policy too, I think we will build on that. But tell me, what's the WHO's priority in terms of taking the program and the policies forward? What do you want to do within the WHO, and what does the WHO want member states to do?
Okay, thank you. Well, let me just clarify. I am going to speak not for Turkey here again. I am Turkish, but I'm not speaking for the member state. I am here to represent WHO and the Global Hepatitis Program. So this talk is going to be 5 minutes. I timed it before, So I will have to go back and specify and emphasize a few points that I have prepared because I believe that it's important that WHO says these things. So bear with me, it won't take long. We all know that viral hepatitis is a global public health problem affecting millions of people every year, causing disability and death. And globally, overall, around 500 million people are chronically infected with hepatitis B and C viruses, and approximately 1 million people die each year from causes related to viral hepatitis. An estimated 3 people out of 5 with liver cirrhosis and 4 people out of 5 with primary liver cancer have these diseases because of hepatitis B or C. Millions of people are living with viral hepatitis, and millions more are at risk because most of the people who were infected long ago with either of these viruses are unaware of their positions, and they are at risk of developing severe disease themselves, and they are at risk of passing these disease to their loved ones. Viral hepatitis places a heavy burden on the healthcare system because of the costs of treatment of severe disease. In many countries, viral hepatitis is the leading cause of liver transplants, and as we all know, these end-stage diseases are very expensive. Chronic viral hepatitis results in loss of productivity and have dire effects in people's personal lives and livelihoods. In recent decades, the viral hepatitis has not actually got the attention it deserves from the global community. Although the burden is very high, the problem has not been addressed properly. Some of the reasons are that maybe the disease is mostly silent or benign in nature in its early stages, and the insidious way in which it causes chronic liver disease. Decades-long delay between the infection and the expression of the disease, chronic liver disease or liver cancer, made it difficult in the public's eye also to link these diseases with previous hepatitis infections. And these probably are the results that we are experiencing, the silent epidemic we are now. But there is a solution. We've been talking about these solutions. We know that there are affordable measures, such as vaccination, safe blood, safe injections to reduce the transmission. We know that most of these interventions, they do not only exclusively help in the transmission of hepatitis, by stopping the transmission, but they are also effective on the prevention of other infectious diseases. And furthermore, we know that there are current therapies for hepatitis B and C, and these give the healthcare providers very effective tools to fight the disease. We talked about it today, but for the first time in history, now hepatitis C is also curable, and new therapies are promising than ever. Recognizing this tremendous burden, the 194 member states of the WHO adopted Resolution WHA 63.18 in 2010, calling for a comprehensive approach to the prevention and control of viral hepatitis. In response to this mandate, WHO established the Global Hepatitis Program about 1 year ago at its headquarters in Geneva, with focal points in all 6 regional offices. And as one of the first activities, we published a framework for global action this year. This document outlines WHO's vision and provides a conceptual framework for concerted action. This is published online on WHO's website. You can access that. Now, WHO is only as strong as its partners and collaborators. Evolving concepts about health and the articulation of its links to poverty, equity, and development have recently widened the range of WHO's partners. No longer the domain of medical specialists only, health work now involves politicians, economists, lawyers, communicators, social scientists, and people, just ordinary people everywhere. The involvement of civil society has profoundly affected not only the concepts underpinning public health, but the formulation and implementation of public health programs and policies as well. Non-governmental organizations and other civil society actors have engaged with WHO to implement health programs at country level. They made outreach to remote areas and populations possible, advocated public health issues to a broad audience, addressed sensitive issues, and worked in alliance with WHO to raise funds more effectively. We all play different roles in life as we pass through it. One day, you're a beloved daughter. The next day, you have your own daughter. One day, you're caring for a patient with a belly full of ascites. The next day, you're talking to a distinguished group of people in Brussels. One day, you're a parliamentarian. The next day, you're a patient. One day, you work for a government. The next day, you discover the cure to human misery in an underground lab. One day, you lead an NGO. The next day, you are the Minister of Health. Now, let's play our roles individually and as part of a bigger goal of preventing and controlling viral hepatitis. And let's hope that by working all together for this common goal, and within our lifetimes, hopefully, one day we will be able to say to our children, I had my role to play in the fight against viral hepatitis. You know what? I think I did a very good job. Thank you.
Thank you for reminding us that politicians are mortal. And you're quite right. I think it was a few days after I'd announced that I was not standing again. I'd done 27 years of elected politics. I thought it was quite enough. I had a triple bypass, totally unexpected, 24 hours notice, and done in Brussels. I commend it to you. That was my testing of the cross-border health market, and very successful, I hope it was. But no, thank you for that. Let me pick up though on, you were talking there about a range of specialisms which are the players in policy nowadays. And you have responsibility, I think, for training on pandemics and so on. And I just wonder if there's anything from your, I know that's meant to do with flu and so on, but your pandemic training program, are the lessons that one could learn from that in terms of training these people who are not necessarily thinking of themselves as health specialists, but need to be made more aware? Is there something we could do in that field?
That was my previous hat, actually. I was in the global influenza program then, and I was responsible for preparing the WHO guidance on pandemic preparedness. And there are a lot of things that we can take from that area into this area that I'm working right now. First of all, in that area, the importance of national preparedness planning started in about in the year 2000s, early 2000s, particularly when in 2000, after 2005, where there were avian influenza outbreaks. And this prompted the national governments to look into their own planning. And then from 2005 onwards, about 118, in 2009, April 2009, when we looked back into the national plans, 118 countries had made their national plans in 4 years' time. So that is something that I'm actually, now that we are looking globally at the hepatitis planning at the national level and seeing how few countries have their national plans, this is something that I would really like to see globally in countries. And there are things that we can do, and we are working on things, and I'm glad to, this has been a very, very learning experience for me to be with ALPA. I have attended their policy meetings actually, and I have never before met such a dedicated, motivated and competent group of people, and we're hoping that we will work together, especially in promoting national planning for viral hepatitis.
That's great. Can I?
Compliment them and you get an applause.
I just want to. I want to get that bit of applause from ELPA to itself. But can I tempt you a little further? I mean, you've rightly highlighted the need for national plans. What's the biggest missing element in the plans you've seen so far? Or the plans for plans? I know we haven't got many plans yet.
Wildlife rights plan? Are you asking about national wildlife rights plans?
Yeah.
The missing?
Well, what
I'm just happy that they have their plans, so
Okay,
that we will look
okay.
into them and take them as an example.
All right. Well, just say what if you were to look around, particularly the European Union countries, is there one area of work you think they're not doing enough on?
You know, from WHO Geneva, when we look at the European Union countries, we usually look at them for more collaboration, because they are hardly on our radar for support. In that sense, we work with them very closely, and we hope to start working with them more and more closely, because we are a new program. We haven't yet reached out to all our collaborators globally. But I mean, I can understand that from the patient's perspective. There are many things to do, many areas, gaps in healthcare provision in the European Union, but I believe that there are places in the world that are in need of our help more and more than the European Union. So I don't think I can sit here and criticize the European Union right now.
No, but that's important actually. We must always remember that Europe has a policy for developing countries, low-income countries, supporting Millennium Development Goals and so forth. And perhaps that's something we should make sure that hepatitis is looked at when we plan our spending on development and humanitarian aid.
Let me just point out one more thing here while we're talking about collaboration. We at the World Health Organization are now establishing a network that even the name isn't yet clear, but it will probably be, the idea will be to have a global hepatitis network of all the stakeholders who are involved in hepatitis work. And we are currently writing its charter right now. And this collaborative platform will hopefully bring together everybody involved in this work and help WHO's work in furthering the viral hepatitis agenda.
That's great. Thank you very much. Now let me turn to Charles. And Charles, in a way, you came into this area, apart from your own personal position, health position, by frustration at being unable to find out the advice and the information and so forth. How are you developing those frustrations into policy advice for member states?
Tricky. That's a very tricky question. I think I'm going to be very political about this and say, that's a very good point, but what I really want to talk about is... And I'd like to start, first of all, by publicly thanking you, John, for the tremendous support that you have given to the subject of hepatitis, specifically in the European Parliament. And you've been one of our absolute key supporters over the years. It's been so important, because this has been a very under-acknowledged issue. And there is this challenge, I would say, at the moment, of the emergence of non-communicable diseases and that agenda, and the risk that communicable diseases will be downplayed as a result. And exactly what you were saying about the importance of not doing that in Bulgaria, I'd like to echo, because one of the things about communicable diseases is that often, and this applies very specifically to hepatitis B and C, if you don't do anything about them, they spread. But in the case of B and C, we have an opportunity to do something about them and reduce not just their impact, but actually the numbers infected over time. So
you know, I think if you look at HIV, for example, you can see what can be done about controlling an infectious disease and really reducing the mortality and reducing the infection. So that's the first thing. We still have this big battle about hepatitis as a priority issue. And I think that, you know, key to changing that is patient advocacy. But there is a problem there, and as the gentleman from EATG so rightly pointed out, we are a bit lacking in the number of patient groups, their capacity to be involved in policy, and it's something actually we really need to foster. It's absolutely wonderful to be at a meeting that's been convened by a patient group umbrella organisation with all the patient groups here. It's wonderful how much leadership has been shown by a patient group in Bulgaria to interact with the Ministry of Health. And this, you know, this is definitely the way forward, in my opinion. But it is a challenge. But as John Dillon rightly said, you know, for some reason, doctors are not seen as voters, whereas we are, and we really do have the capacity to change the political environment. And what that means in terms of hepatitis is really, I think, national action plans, as we've talked about here, and not from a patient perspective, but from a planning perspective. My view on the answer to your question, John, about what is really missing is data. Surveillance for hepatitis is just tremendously poor. And again, it's been a very unfunded area. And there are lots of countries who really don't have a good idea what the prevalence is, what the incidence is, where it's concentrated. And it's very difficult to come up with an effective action plan if you don't know the basics. So that is something that ECDC, I hope, are working on very hard. I know that WHO are looking at guidelines around surveillance, all of which will be a help, but it's also about making sure that our national institutions are really engaged in doing this. I mean, I assume that it, you know, almost everywhere you go, just to take HIV, and I'm not having a go at HIV, I'm showing what can be done if you put resources into something. In most countries, you will find that you have, you know, 10 times the number of people working on HIV as you do on hepatitis, even though the prevalence may be completely the opposite. And it's about trying to give the same level of commitment to hepatitis as has been shown in HIV, because it's been shown how effective that could be. And in terms of national action plans, one of the things that I think would be very useful is a regional action plan. Now, 2 regions of WHO, Southeast Asia and the Americas, are already well advanced in the development of regional plans. And there are 2 reasons why this is important. One is that they give an overall framework, although that already exists to a degree in terms of the global framework. But secondly, at regional level, it involves much more direct input from the countries. And it would be extremely nice if your chairmanship of the standing committee for the Euro region of WHO led to a full-time focal point in Euro office and immediate commitment to the development of a regional plan. And having said that, I think that it's still, whether that happens or not, absolutely up to us at national level to keep the pressure on our governments to start developing their own plans. And you know, I'd really like to commend ELPA for the production of this index as a really useful tool in doing that. Because if you look at countries that have got national plans, you'll see that by and large their indicators are a lot better than the countries that don't. And that's kind of the answer. Good action plans deliver results. And I think both France and Scotland show that really, really clearly. So we need to go forward, we need to take the tools we have and keep pushing. Thank you.
That's interesting, Charles. And I take your point about regional policy, but which comes first? It's a chicken and egg question. Should we have all the national plans in place first, or should we have a regional plan which can then inform the formation of national plans?
Okay, the situation, we need to look at this from not an aspirational or not an overly optimistic point of view. It is going to take a very long time to get the national plans in place. There are countries now who are very visionary, like Croatia and Bulgaria, who have decided, yes, we need a plan now, and they're already starting. They don't need a regional plan. But there are going to be a lot of countries that lag behind. I actually think Ireland will be one, for example. And those countries perhaps can be really usefully engaged through the development of a regional plan. Plus, I have to say that this is going to be dynamic, and that plans will need to go on being developed. I mean, France is a perfect example of that. They've had a series of iterations of their plan, starting in '99. And you have to keep doing that. So it doesn't matter if you have a national plan in place, you'll find that a regional plan will still be very useful. And I'd like to have one other thing that I meant to say. There has been a question as to whether, you know, an EU plan would be useful. And I think it would, but I think the truth of the matter is we'll never get it. So it's probably not something that we need to push for, but what we do need to push for at an EU level are some of the key elements, like recommendations on screen.
Okay, although it might be helpful to have a WHO Europe plan, because that then can push back through the health ministers attending those meetings. Thank you, Charles. And just highlighting the point you made about data and the need for that. That's appeared I know in the report. There are gaps there, and I suspect alongside the need for data goes the need for accurate assessment of the costs. The costs both to implement the plans that we bring forward, but also the costs of not implementing them, because that sometimes is the most telling figure to give to finance ministers. But thank you to my panel here. Now I'm going to open up the discussion. Let me just welcome onto the platform Antonia Parvanova, who was my colleague and is still a member of the European Parliament, also from Bulgaria. So the platform is weighted by Bulgaria in the nicest possible sense. And we'll come to Antonia after we finish this panel discussion. But so welcome. But let's see who would like to make a comment. Yes, please. If you just say who you are and where you're from, and then fire away.
All right, I'll try. Thank you very much. My name is Katrina Ostenberg. I've been working for ELPA for a number of years now, and I'd like to actually link Charles Gore's last point about an EU recommendation to what you, John, said at the very beginning about the written declaration, which you helped bringing to life way back in 2007, I believe. I mean, in that, the European Parliament actually called for a Council recommendation on viral hepatitis screening, I believe. And in view of the fact that now, with Bulgaria, with France, and the northern part of the UK, we actually do have countries which actually lead the way. I mean, wouldn't that now be the time for these countries to go back to their colleagues, their fellow health ministers in the Council of Ministers, and say, let's try and give the European Commission a mandate to help formulate those EU Council recommendations just on screening, because that way you'd have some new momentum on that issue. Thank you.
Thanks, Katrina. Do you think Lucas has a chance of that?
Council conclusions, December 2013.
True, Council conclusions is one way that the Council is encouraging Member States to take action on certain diseases or aspects of health. Unfortunately for the Cypriot presidency, we only had 2 Council conclusions. One was on organ donation and transplantation, which is a very sensitive issue for the citizens of the Member States. And the other one is healthy aging across the life cycle, which is quite an interesting